As we reflect on Workers' Day, we have to think about frontline workers. I mean, they were and still are front and center of the fight against COVID-19. And recently, the floods in KwaZulu-Natal also made things very difficult for various hospitals. But let's catch up with Rich Sicina, who's the president of the Young Nurses Indaba trade union. Rich, thank you so much for your time. I mean, today is a day for workers, and we are meant to appreciate, the workers globally. Let's talk about your reflections.
Thank you very much, my sister, for having Young Nurses Indaba Trade Union on your show. Good evening to your team and the viewers at home. As Young Nurses Indaba Trade Union, where we are sitting, we were saying today, Workers' Day is meaningless to us, more especially because after 2 years later, after the pandemic that actually showed all of us flames, we were thrown into that deep end. We rose above the challenges. We sacrificed a lot. We struggled. We buried our colleagues and many nurses, about 1,300, who actually frontline workers who passed on because of COVID-19, and still we feel we were not appreciated enough. Verbal salutations are not enough, more especially from those in positions of authority. Our government, the HODs, the ministers, it's the job of the media to verbally salute us and say keep on keeping on, comrades, but not our employer, who instead of at least giving us a token of appreciation and say we thank you, here is your resolution 1 of 2018, we are going to implement it, but no, our government said I'm not coming. We are really disgruntled at the moment. That is why we took a position as the need to say this Workers' Day, actually, it's a day where we need to tell everyone, let's stand up and stage a war against any form of injustice. That Department of Health, public healthcare system in particular, is under siege.
So, Rich, I'm listening to what you're saying, and you're saying that salutations don't help. You need a token, and you also allude to that resolution that you say must be honored. Is that the collective bargaining agreement you talk about?
Yes, isn't it that is why we are saying our government, the employer, was actually out of order for actually refusing to implement that resolution 1 of 2008, taking the unions who are in the bargaining council, because the Young Nurses in our trade union at the moment, it's not in the bargaining council. We are working to get in there because we have realized even that bargaining council, it's just a hostel. That is why so many workers on the ground are just not happy. We are not getting what we want to get, because unions have decided to take the position of the employer. They are actually not striving to liberate workers on the ground. And as why it was an alternative, we are saying government was not supposed to take unions to court just to implement one leg of the resolution. They were actually showing workers on the ground, frontline workers in particular, the middle finger. They were actually not. They were saying we are steadfast, we've been resilient, but saying that verbally alone, it's not. And again, we are working very hard as Young Nurses in the trade union on the ground so that we can actually go into bargaining council. We are tired of reacting. Like we are saying that resolution is the job of unions that are in the bargaining council. They were supposed to push government against the wall to make sure we get that resolution, but they really failed.
So, Rich, as we speak tonight, I mean, you may be in a different sector, but you are still in the public sector. We are talking just 2 days after the release of the State Capture Commission's report, the fourth installment that is. It talks about the weaknesses, the vulnerabilities of the system in the public sector that exposes it to corruption. And you are talking about, as workers, you are not happy about the fact that you've not been given what is due to you. You are reflecting on this day, in a very sour manner. talk to us then about, when you look at the State Capture Commission's report, these are your colleagues in the public sector who are also, accused of wrongdoing here.
I remember, my sister, we were before the first day of the lockdown. We're in Pretoria. Minister Thulas Mnisi was there, and other ministers. We actually warned them as young nurses in Indaba Trade Union to say you must guard those funds, COVID-19 funds, because we know the vultures within that department, within the ANC in particular, they are actually going to make sure that money goes down to their own pockets and stomachs. And it happened, they were exposed. Obviously, it was inevitable that the commission of inquiry was actually going to be instituted, and it exposed a lot of them. There is a recommendation, by the way, in that report to say some ministers, deputy ministers, must be shown the door. They must be removed. But until today, and we all know how ANC works, we know that they are not going to show those comrades that door, because it simply means if they are showing, for example, Zizi go to that door, it simply means they must show everyone that door. There are so many people in the ANC who need to follow the likes of Bandile Masuku, including the president himself, because these things happen under his leadership. If the ANC is collapsing, the Department of Health is collapsing, nurses on the ground are frustrated, and they are just going to work because they have bills to pay. While we are here, we are saying we have passion. When we are passionate about these things, we know no one is going to be held accountable. That is why we say, let's work the ground so that we can push those who are corrupt against the wall, because that is why the corruption in South Africa is rampant. It is because these politicians, no one is holding them accountable. It's okay for the likes of Zodim Kiza to be involved in whatever they were involved in. They are just going to step aside. It ends there. While people on the ground are suffering, the general public in particular, because they are the ones who are subjected to substandard way and mediocre in our facilities.
All right, Rich, thank you so much for your reflections on Workers' Day. That is Rich Sicina. He's the president of the Young Nurses Indaba.